people aren't assessing this issue properly. And this is our eyesight. A lot of doctors are dropping the ball.
Yeah.
And not making people aware of this disease, right? My kids have dry eye disease. They're in front of their tablets. They're not blinking enough. They're not doing the 20-20-20 rule, right? And they're not blinking, enough because they're on their tablets. They're doing Zoom meetings, virtual with school. And, at the end of the day, they're rubbing their eyes, right? It's because of, dry eye, So let me, can I share my screen?
Yes, that would be great.
Yeah.
Okay. So there we go. Okay. So has everyone heard of I-MED?
Yes, we saw the link.
Okay, good. So I'm going to be very quick. We are a Montreal-based company. We've been around for over 32 years, and our founder, Ilan Hoffman, who lives in Montreal, his son has taken over, but he's still on. He's the chief scientific officer, and we're an R&D company. He's researched, developed, and manufactured these products. All of these products except for our mask, which I'll be giving you guys as well. So pretty impressive that, we're privately, we're a family private held company. We're still in existence after 32 years. And we've been, treating dry eye disease for 32 years in animals, just as much as we are in humans. So we deal on the vet side as well, and we deal on the human side, which is pretty cool. And we're the manufacturer. So all of our products are only sold through doctors' offices, optometrists or ophthalmologists' offices. And the reason for that is because you need an education when buying the right drop or wipe or omega. And I'm going to tell you a couple of differences between ours and the ones in the pharmacy. Okay, so let's start. We have 3 drops. I'm just going to move you guys on top here. We have 3 drops. Do you see my cursor?
Yes.
Oh, great. So this drop, Eye Drop Pure, is for contact lens wearers. Do you guys wear contact lens?
No.
No, nobody does. Sjögren's patients can't wear contact lens, your eyes are way too dry for that. So we have our Pure Gel for you, which is for severe dry eye. What's nice about our products is we have 2 ingredients. We have hyaluronic acid, which we produce in our bodies, and it holds 1,000 times the amount weight of water. And the reason why they use it in Botox, in joints, in drops, is because it actually, stays on your surface a lot longer, and you want it to stay on your surface. You have creams now that have hyaluronic acid in it. We have medical grade hyaluronic acid. So if a drop falls on your face, you rub it in, because drops are good. Hyaluronic acid is great for wrinkles as well. But the drop that you'll probably absolutely adore, I love the Eye Drop Pure Gel, but then we got the Eye Drop MGD. MGD is meibomian gland dysfunction. So we have glands in our upper lid and lower lid, and those glands get blocked. Hence why some people do MGD expression. Now, 80% of dry eye sufferers suffer MGD disease. So most people who suffer dry eye suffer from MGD. So MGD, it's mostly women over the age of 40, I'm there, suffer from it. So lucky us, right? This is our drop. So it comes in a bottle that's a multi-dose bottle. It has a one-way valve. And what that means is there's no air ever going back in. So it will never be contaminated. There's no preservatives in this drop. So once you drop a drop, you can see how viscoadaptive it is. You can see that? There's that extra little drop. Can you guys see that extra little drop?
Yeah.
You either want to wipe it off or shake it off. Now, I always wipe it off and then I put the cap back on. And the reason for that is it gets re-sterilized within 1 minute. There's silver ion. So a lot of people touch it to their eye, and that's okay. Just shake it off. Make sure you don't want anything damp ever, right? Because then it breeds mold, right? So you want to make sure it's nice and dry. This has hyaluronic acid and a lipid. And what that does is it protects all 3 layers of your eye. So you will see, have you been using this, Amy?
Yes, and I love it.
Okay, so I can sit here all day and tell you how much I love it. And, you know, I sell it, you know, but the best is when you try it and you love it. So I'm going to be giving all of you a sample of the MGD and also give you a sample of the Pure Gel as well, which I really, really like. So this will blur your vision for about 30 seconds. What I do is I put it right beside my toothbrush. I put a drop in my eye and then I brush my teeth. By the time I'm done brushing my teeth, I'm ready to go. I do that at 1 in the morning and 1 at night. And I feel actually relief all day. And I wear makeup and, you know, by the end of the day, I'm ready for my next drop. So any questions on this? Once you open it, it is good for 12 months. It won't last 12 months. It won't last 12 months, but it is good for 12 months. So if you drop it at the bottom of your purse and find it, you know, 6 months later, it's still good. It's great. Any questions on that? This is like a windshield wiper. Every time you open and close your eyes, it coats the cornea. It's a great feeling. Now, this eye defense, once you open it, it's good for 8 weeks. So the first time I tried this is a nighttime ointment. Once you put this in your eye, you go right to bed. You will not see at all. When you wake up in the morning, how do you find this when you wake up, Amy?
Well, I can see that I have it in the corners of my eyes. So it's just kind of like, it's really stayed in, which is really good. Yeah, I just have a little bit in the corners of my eyes. Yeah,
which is great. So this has hyaluronic acid as well, medical grade hyaluronic acid. So you have it, you just rub it in, right? Okay. I actually put this in my eye and I use it as eye cream.
Oh, nice.
Yeah. So this is only good for 8 weeks. I have tested it for longer than 8 weeks because I have one in my makeup bag. I have one in my cottage. I have one everywhere and I love it. I even put it on my lips. It feels wonderful. So if you look here, you could see. Yeah. And it goes in really nicely, like really, really nicely, but it will blur your vision. So I thought, oh, I'll put some in, it will blur for a little bit and I'll read my book. No, I went right to bed. So go to bed. The first time I tried it, I did not like it. I gave it a second chance and I gave it a third chance. And then I got used to it because it's a weird feeling in the eye.
Yes.
So are you using this at night before you go to bed in lieu of an eye drop?
No, I would use, so like I would put my eye drop. I can show you the order of use. I'll tell you the order of use, but it would be drop, wipe, or wipe, drop, and then ointment.
Oh, okay.
I would go all in. But I'd also use my mask too. Do you guys use a mask, a heating mask, a warming mask?
Never.
Okay, so that's going to be your lifesaver. So what's nice, I'll get to the mask in just a sec. So I don't need to get into what level. I've told you one's for contact lens, one's for severe dry eye, one's for MGD, and one is maximum relief. Eyelid and lash. This is the best invention. My husband, I've been working with I-MED for 8.5 years, and he hasn't had a sty in 8.5 years.
Wow.
So he's happy about that. This is also a nice eye makeup remover. We have 2 formulations, regular eyelid and lash, which is the yellow one, and then eyelid and lash for Demodex, which has tea tree oil in it.
Oh,
So
nice.
one is for blepharitis and one is for Demodex. Demodex are little mites, it's lice on your eyelashes,
Wow.
which is crazy to think of that. 80% of the population have Demodex. So it's very, very normal. So if you do this, if you have this, it will go away within 4 to 6 weeks. I've been using this for 7 years now.
Wow.
Every day, all day. So with this wipe, you can see they're pre-moistened pads. So blepharitis really is dirt around the eye.
Mhm.
And you want to take away that bioburden, they call it, which is dirt. We tend to just wash our face and we don't take enough time to really wash the dirt off. So there's a mild preservative, but this mild preservative won't hurt you. So what you do is you go in a circular motion. I might come out with a little bit of eye makeup. And what's nice about this is you can pull down your lid margin and get it in your eye.
Oh,
Which is really nice. I've used this on my daughter when she was 3 months old, and the doctor said she has an eye infection. So I put the eye drop in my eye to see if it would sting, and it stung. And I was like, what? I'm not putting that in my daughter's eye. You know, she's 3 months old. So I took a wipe. Now, they suggest 3 years and older because they've only tested 3 years and older. But I knew every ingredient in here wouldn't hurt her as much as the preservative that was in that drop, in that polysporin drop. And without a doubt, after 2-3 days, her eye infection went away because it's just dirt getting in your eye, right?
mhm.
So what I do is I wash my face. I take a wipe after, wipe off all the dirt, turn the pad over, do the other side. You can use one pad. Unless you have an eye infection, I wouldn't do one pad. I would use 2 pads. And then I put a drop. And then at night, I would put the ointment. And maybe 2 to 3 times a week. You could do it 7 days a week, but 2 to 3 times a week, I would do a mask, a warm compress. And what that does is it takes all, it melts your glands. So when you take off the mask, you're going to feel it's a little blurry, and that's good. You want it to be blurry. Just take a wipe and wipe it away. So you have your regular eyelid and lash, and then you have the one with the tea tree oil. Same concept. So tea tree oil has a smell. Not everybody knows that. So it has a smell. It's a distinct smell. Some people love it. Some people say they don't like it. And it has a cooling sensation. So this one you would rub like this, but you don't pull down your lid margin. Now, I've tested it and pulled down my lid margin just to see if it would hurt, and it doesn't hurt. What's really nice is if you're scared to get this in the eye, create a nice barrier with your drop.
Okay.
And it creates a nice barrier and you get it in your eye. You rub around your eye. So it does have a cooling sensation and it goes away within maybe I would say a minute. But do you guys have any questions on the eyelid and lash? No, okay. It comes in a pump as well, or cleansing pad. I personally like the cleansing pad because in the pump, you have to put it on a pad. And this pad has a little bit of grit to take away the dirt, all the dirt. You do not rinse this off. This has medical grade hyaluronic acid. Once you put your drop in, then you put your cream on your face after. And it just holds all that moisture in place. Did anyone have any questions? No? Okay. So eye relief. This is the mask. Amy, you got one of these, right?
Did, yes, and I'm using it every night. I love it.
Okay. First of all, it stays warm for a good 14 minutes at a certain amount of temperature. Now, it depends on your microwave. You need a microwave. So if you don't have a microwave, I've tried it in the oven, and it warms up, but it's not recommended. Now, I have some people who put it in their rice cooker. I mean, I don't know, it hasn't been tested. So this, they say to put it in the microwave for about 20 seconds. I put it for 40. My microwave needs 40 seconds. Always test it on the back of your hand so you don't burn yourself. And then you leave it on, and honestly, 15, 20 minutes, put some nice music or podcast and just daydream, just relax. It's wonderful. And you can either use it hot or cold. Cold is more for sinus, colds, headaches, anything like that. It helps with dry eye, it helps with MGD, it helps with styes. Everything gets, taken out of the system. It's a wonderful mask. And what's nice about this mask, it has a removable cover, and it's blue, and that's machine washable. You never want to wash your mask, but you want to wash the cover, just like a pillowcase. You can use it a couple times. Make sure when you do use it, you don't have makeup on and you have a clean face. Any questions on that?
Yeah, yes, I would like to ask, can you buy just the cover?
No,
No,
no, you can't.
Mm.
But it's nice to meet you, but I'm going to be giving you all a mask. So, and this mask, honestly, maybe a good 2 years, it will last you. So the mask will retail for about $40. And it's expensive, I'll be honest, but the reason why is you pay for what you get. You can get the $10 mask, but it won't heat up and it won't stay hot for as long as the other masks. And that's the difference.
Yes, I have a cheaper version and I don't like it.
Is it the Bausch and Lomb?
I don't know the name, but it's like
The plastic?
plastic, yeah.
What?
Stick to your skin. I don't
Yes,
like it.
so it's more like it's the Bausch and Lomb, and it looks cool, it looks nice,
Yeah.
and you put it on, but it doesn't stay warm and it doesn't do the trick.
No.
So once you have this, you'll be in heaven. You'll absolutely love it. But like I said, remember, test it in your microwave and test it like baby's milk. Test it on the back of your skin because you don't want to burn yourself. Anything else? It's good for swelling, puffy eyes too, which is great.
The mask with the eye defense gel, would you put the gel after the mask or before the mask?
After.
Okay.
After the mask. Yeah. Right before bed.
Perfect.
Yeah. And if you do this consistently and you comply, you will see a huge difference in your dry eye. This will help you tremendously. I can guarantee that. I know, I do it every day. So I'm a dry eye sufferer. I don't have Sjögren's, but I do suffer from dry eye. Like I said, women over the age of 40, now my kids, 9 and 10, they suffer as well. I put drops in their eye in the morning and I put it at night. And I make them do their wipes. What's really nice to do in conjunction with your drop and your wipe is it reduces inflammation. Your eye is inflamed because it's dry.
Yeah.
So you need to do both together, which I will be giving everybody that. Okay. Does anyone take omegas?
Yes.
Yeah, I do.
Okay, good. Nobody's on blood thinners?
No.
No? Okay. So that's the only contraindication. So which omegas do you take? The one from the pharmacy, Costco,
Costco.
Yeah,
Yeah.
yeah. So I shop at Costco too,
Mhm.
but I don't buy that. And I'll tell you the difference. So we are coming out with a liquid version, which I'll be more than happy to offer you that once we come out with it. But for now, well, I could touch these because they're mine. They're the big pills. Hold on, let me show you. See?
Yeah.
So they're the
Yeah,
big pills.
Mine are like that too. It's a different brand though. It
Yeah,
was an optician specializing in dry eye who recommended. I'm trying to remember the name of it. I should go look at the bottle because I like to compare the
yeah,
ingredients.
go look, show
Yeah,
me
I'm
the
gonna go-
bottle.
I'm
Yeah,
gonna
yeah,
go
go
grab
look
the
at it.
bottle.
Yep. So let me tell you the difference between this and the one you buy at Costco.
Yeah.
So this is called re-esterified triglyceride format. And what that means to me and you, there's no fish burp, and it gets 100% digested. And that's why there's no fish burp. So you want to eat it with, oh yeah, that's PRN. Yeah, that's a good one. Yeah, that's a good one. You paid a lot of money for that.
I sure did. If yours is just as good and cheaper, I'll take it.
Yeah. So how much did you pay for that, Lynn?
I have to look it up. I order them online. I think about in and around $90.
Yeah. So yeah,
Of, how many pills are in here? I'm just looking. 180.
okay, there's 120. How much omega do you have in there?
Where does it say? Fish oil, 3,564 milligrams.
Yep.
EPA, AEP, 1680 milligrams.
Yep.
DHA, ADH, 561 milligrams. Other omega-3 fatty acids, 159 milligrams.
Okay. So pretty much the same. We have 1,200 per pill, and you only want to take about 2,000, a little bit, 2,200 about a day. So we suggest 2 a day. I take this with my breakfast.
Okay, I take 3 a day of these.
Okay.
So you're talking, this is a 60-day supply for about $90.
Right. This is 60 day because it's 120. And this will sell for about 70. So yours is manufactured in Norway, mine's manufactured in BC.
Mhm.
So number one. Number two, yours is good, but and yours is re-esterified triglyceride as well. So the difference between this one and PRN and the Costco one is the Costco one has ethyl ester, which is alcohol. And what that does is it diminishes the amount. So you'd need maybe 6 pills, even if it's written 2, you need 6 to get the same amount as this. So it is less expensive, it's cheaper, but you're also getting, just like the mask, a cheaper version of it. So you're not getting the full effect of this. So I'll be giving each one of you one of these as well.
What does that retail for?
70.
70? Okay, so basically a 60-day supply is $70 versus $95. So it's about
Yeah.
$20 less.
Yeah, for
About
sure.
$10 less a month.
Yeah.
Yeah.
So we have sardine, mackerel, and anchovies, and they're all wild caught. You don't want farmed fish. And the reason why we take these omegas is because we don't eat enough of the right fish. It's not the salmon, it's not the trout, it's not the, it's the little fishies.
Yeah.
It's the little fish that have the most vitamins for us. And unless you're eating, 2 cans of sardines a day, which I can do 1 a week, then you're not getting it enough. So any questions on that? Nope. Okay, good. It's Health Canada approved, GMO. It's great. We're coming out with the liquid version and it tastes delicious. And it will be 48-day supply for about the same price, $70 but it's liquid form. So you can put it in your smoothie, you could put it, you know, you could put it on anything really. EI, so let me just get into this. This is a treatment. An EI treatment is an IPL, but ours is called IRPL, which everybody has an intense pulsed light, but we have the regulated pulse light. So when you get the pulse light, it's a treatment. I think I have a slide on it. No, I don't. How do I go back here? So what happens is they put gel here and they do 1 flash, 2 flash, 3 flash, 4 flash, 5 flash. And what that does is it heats up your meibomian glands, and you do about 4 treatments. Also helps with wrinkles and age spots, just like hyaluronic acid. And you'll see significant results in for 3 to 4 years, depending on the person, which is pretty amazing. So we offer that as well. It would be your optometrist who could provide you with that. But, you know, again, awareness. A lot of people aren't talking about it, right? You'll see these in dermatology. About 15 years ago, one of the doctors realized, oh my gosh, he was doing IPL for wrinkles and age spots, and realized this woman, obviously, didn't have any more dry eye symptoms. And he was like, what? And then they did studies and study after study after study. 15 years later, you know, they're starting to use this for dry eye disease. So, and it works. It really does work. You'll reduce the amount of drops you use. Instead of using, you know, 4 to 6 times a day, which you can use this 1,000 times a day because there's no preservatives in it. If you do the EI treatment, you're only going to use it maybe twice a day, right? So it helps for that. Did you guys have any questions?
How much?
How much? Oh, is it treatment?
Yeah.
It's about, you guys are in Montreal, so maybe 1,000 to 1,200 for all 4 sessions. Yeah. $1,000, but honestly, so worth it. So worth it. What's nice about the regulated one is they want you to overlap so that you don't miss out, you know, because you're really hitting the parasympathetic nerve and they don't want you to miss out, and it's regulated. So there's no way you will ever get burnt, ever, which is always the scary thing when you're dealing with a light treatment, you know, around your eyes. You don't want to get burnt there. So that concludes my presentation.
Well, that was wonderful.
That was good.
Thank you. That was great.
Nice.
Information, really good.